Okay, is everybody seeing chapter 23 on the screen?
Yeah.
Yeah. I don't trust myself. All right, so let's get into the dental hygiene care plan. All right, that is where we're at. And your care plan is really an essential part of the dental hygiene process of care. You have all your assessment data. What are you going to do with that? Because it addresses the needs of not only the entire oral cavity, but it's also getting more into body stuff too. We're treating the entire patient now. It's not just their mouth. Um, and it's based on assessment of factors that can influence the oral environment. So in everybody's OHE book, they're usually going to have a picture of the oral systemic link, a picture of the body, and then arrows going out for the brain, the heart, the kidneys, the liver, and oral systemic link. But you want to consider the patient's individual health factors, okay? Customizing it for the patient. And it is part of the three-part plan for all of your patients. And it is a major influence on future oral health because we are educating the patient on what they are at risk for. We don't want anybody coming back saying they never told me. Okay. We can inform, we can educate, and then it's up to the patient whether or not they heed what we are talking about. Right. So there's a lot of different models for the dental hygiene care plan. And depending on the template, if your office uses templates, I love templates because it keeps everybody doing the same thing the same way, and you know exactly where to look for each and every item. I particularly like paper charts that are color coded. The yellow was always EOIO. The pink was always yellow for me was always perio assessment. But you knew exactly where to look and what to look for. But this keeps everybody on the same page, looking at the same things for every patient and documenting them, whether they're present or not. Because if it's not written down, it never happened, right? So what's the part of the care plan? Okay, it's your periodontal and gingival assessment. It's your caries risk control. What other things can be part of your care plan? Think about the medical history. Is your patient diabetic? Do they need to have morning appointments? Do they need short appointments? Do they need a medical consult before you can work with them? What other referrals might you need? Then we've got the components of any written care plan. Demographic data, assessment findings and risk factors, periodontal diagnosis and status, and caries risk status. So you have all of this before you make your treatment plan. You've got all of it. What is some of the demographic data? Why do we need to know about that? Why is that even listed? That includes socioeconomic status. Are they living on a farm with well water or a rural area with well water? Are they taking fluoride in? Do they have sealants already? Do they have certain cultural habits that put them at greater risk? Male, female, also hormonal changes. So we've got demographic data, part of the health history, assessment findings and risk factors, Periodontal diagnosis, caries risk factor, okay. Diagnostic statements, that is your dental hygiene diagnosis, your diagnostic statements. Patient-centered oral health goals. Is it going to be to have them quit smoking? Is it going to be to start them using a toothbrush every day instead of once a week? What are the patient-centered goals for that particular patient? Planned interventions. What do you need to do as the dental hygienist working with them, as well as referrals and expected outcomes? If you have a smoker with periodontal disease, that smoker is not going to have the same expected outcomes of somebody who's not smoking. Same way with an uncontrolled diabetic versus a well-controlled diabetic. Very different expected outcomes. Plus, what is your prediction on how the patient's going to follow through? Evaluation methods. Are you bringing them back in 4 weeks, in 6 weeks, in 8 weeks? Are they going to be coming in every 3 months for you? After that, what are you going to be doing? Do you need to do a new perio assessment? Do you need to take a microscopic slide for DNA analysis? What kind of bugs are living under there? That type of thing. Then you've got your appointment plan. And again, your reevaluation is, did it work or did it not work? And we have a reevaluation in our in school. We call it a perio reeval. How's that for originality? But it's 4 to 8 weeks later after you're done with your treatment, and you bring the patient back and you do a whole new assessment on them, a periodontal assessment, including bleeding index and plaque index. Did what you perform for the patient work or not work? Is it a cooperative effort? Are they following through at home? If there's still bleeding, if there's still areas of inflammation, why? Is it residual calculus that you still need to remove? Or is it a patient's lack of compliance? Or do you think they're doing everything beautifully and you have to start looking at something systemically, like diabetes, leukemia, other things you're going to be learning about? Do they need to have referral? So we need to look at the role of the patient. Years ago, instead of it being called patient, them being called patients, the American Dental Hygienists Association, as well as the medical community, were starting to call our patients clients, because a patient seems to indicate that we are doing something to you to treat you, and that's the end of your obligation as a patient. But a client is something that is a give and take. We are making recommendations. You are following them or not following them because you have free will. So what is the role of the patient? That they have to be an active role, because no matter what we do, it's only for a very short period of time. We can get all the biofilm off their teeth, but guess what? 24 hours later, it's back with a vengeance. So they have to have the ability to take care of something on a daily basis. What procedures are going to need to be done? Okay, are you recommending a power brush, a water pick, manual toothbrush? What are the procedures that you need to teach the patient? And then follow through. You see what they're doing, you make your recommendation, and then you see them make their modifications. And that's all what that oral hygiene book is all about, as well as the oral health education skill evaluation. Pain and anxiety control. Are you going to need it? Some patients are very sensitive, others aren't. Studies do show, though, if the patient's pain and anxiety is controlled during treatment, you as the clinician can get in and get out faster with more deliberate efficacy than if you're having to worry about, oh, I'm sorry. Oh, did this hurt? Oh, I'm sorry. And they're wincing and everything else. So the recommendation is before that pain even sets in, and you're going to know if the patient is sensitive during your assessment, they're going to be sensitive when you're going in and digging underneath those gum tissues trying to get that calculus off with that big shovel and not just a little pointy stick. So you want to talk to the patient about pain control, anxiety control. Let's try this. Some patients you're going to say, we're going to want to anesthetize you, one quadrant at a time or one section at a time with local anesthesia. Others, let's try a topical first that we can squirt underneath the gum tissue, see how that goes. But once that pain and anxiety sets in, it's going to slow you down. And even if you do end up getting the patient comfortable, you have tried A, B, and C, and it takes longer for them to get comfortable. Okay. Oh, you thought you could take this and you can't. Let's try some topical first. Topical's not doing it. Let's try a local anesthetic. By then, half the appointment's gone. They've already set up their anxiety. So it's going to be more difficult for that anesthetic to actually be working for the patient. So years ago, if you had a difficulty 3, difficulty 4 patient, somebody with a lot of calculus, the studies bore out that just get them numb. Give them an injection, be done over it. But this is before they had Oracix and some of the other nice topical anesthetics. The deeper the pocket, the more they need anesthesia. Does that make sense? We want to provide evidence-based, individualized care. So it's not just a cookie cutter. If you're a difficulty 3 or 4, you're going to get anesthesia. That's it. It is an individualized patient care. You want to eliminate or control etiological as well as predisposing disease factors and prevent the recurrence of disease. All right, is it primary, secondary, tertiary prevention? Are you removing the plaque traps, so to speak? Is there an open contact, an over or under contoured restoration that is being plaque retentive for the patient? Or is it a food trap where there's a continual insult into the interdental papilla? So you're looking at that and you want to eliminate the signs and symptoms of disease. Now, the disease is never going to go away. Once you have attachment loss, you're always going to have attachment loss. That periodontal status is going to stay there, but they can have signs of health on that reduced periodontium. Factors affecting the sequence of care. Urgency is the first one. So chief complaint. You always want to identify the chief complaint. You might have somebody with teeth that are mobile because they don't have any attachment. There's calculus all over the place. And what is their chief complaint? I mean, the joke is they want their teeth whitened. So you don't want to ignore the whitening. You always address the chief complaint is the standard. Always address the chief complaint. But there are other things that need to be treated before we can talk about whitening of the teeth. First, we need to get you out of pain. We need to clear the infection. We need to whatever it is. Okay, so you don't ignore their chief complaint if it doesn't have anything to do with what they really need to have done. So urgency, you get them out of pain first. Existing etiological factors, you're looking at the severity and extent of the condition, and then the individual patient requirements. What are they wanting as well? So your dental hygiene care plan is your treatment plan. You're going to be discussing with the patient and your faculty. This is something you typically do in private practice when the patient comes in. You do your FMX, you do your assessment. This is what you need. I need to bring you back for 4 more appointments, blah, 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 blah. But the patient needs to sign that they understand. Okay, that's informed consent. So you're presenting the plan to the dentist as well. When the dentist comes in, Mrs. Jones, this and that, determine that they have a moderate amount of bone loss. We're not saying they have moderate periodontal disease. There's a moderate amount of bone loss. There's bleeding, there's this, there's that, there's calculus. So I'd like to bring Mrs. Jones back for quadrant therapy, and this and that. And you're explaining it again to the patient, okay, so that it's not the first time they're hearing it, and you're letting the patient hear it. The patient needs to be fully understanding of what you're explaining. Plus, to be informed consent, they also have to know that they can say no. They need to know cost. They need to know expected outcome. We don't think this is going to work. Because of the length the disease has been going on and the amount of bone loss that you have, all of that stuff. But what we are hoping to do is achieve keeping you stable. So informed consent. Informed consent also has to do with if you do nothing. They always have the right to say no. So if you don't treat this now, what's going to happen is, okay, you can stay in a holding pattern like this, in this diseased state or this current state for a period of time. We don't know how long that period of time is going to be. And then you can have further breakdown. Unlike when I was a new graduate, you've got gingivitis, it's going to turn into periodontitis. It's going to decrease your bone. You're going to end up losing your tooth. I guarantee it. We just don't know. It all depends on how their body reacts. But informed refusal, then you have to come up with philosophy of the office. If the patient refuses, how are you going to handle that patient? How long can they go without having radiographs before you're putting the office at risk and the dentist? How long can they go? You're recommending scaling and root planing, and they come in and just want a prophy because that's all their insurance will cover. So are you over treating the patient for what you're billing them for? You're billing them for a 1110, an adult prophy, which means everything's healthy. But are you doing scaling and root planing really? Most of us are at some point. But that is also an ethical issue. What other additional considerations also are you needing to take into consideration? One of them is not necessarily cost. The patient needs to know how much it's going to cost, but that also is part of the informed consent. We have to tell them that this is what we'd like to do. This is the best thing that we can do for you, but that's option A. Option B is going to be, this is the minimum that we need to do. And then option C might be nothing, or at least let's take care of the decay right now. And you need to treatment plan as far as stages. Maybe it's an economic thing. Maybe it's a fear-based thing. We don't know. That's why it's all customized. And again, everything needs to be explained to the patient. It needs to be documented that it's been explained to the patient and what the patient's response was. So that's why there is a formal plan and the patient signs the treatment plan. They are agreeing to it and saying that it's been explained. I know it's going to be so many appointments and I agree to it. So that is that chapter. Any questions? You guys are really quiet today. my daughter, and show here, wait a minute, worked her first night at Fairfax Hospital. So what does she decide to do for me? She calls me on her so-called dinner break at 3:30 in the morning. Hi, I'm on break. It's like, oh, thank you. Okay, why do all the instructors say that? Alexis, what are you talking about?
I think she means how quiet we are.
Oh, well, some classes are very vocal. Okay, well, we're going to get back into our last thing. If I can find my screen again.
Christy, I have a quick question.
Yeah.
For the tutoring, I was looking it up a couple of days ago, and I'm not sure if they changed it already, but I was seeing that some of the times for the tutoring, it falls on the days that we have class.
Well, that's no good. The tutoring is not hard and fast, and it does change every year, every semester. And it'll depend on what your schedule is, as well as what the second year schedule is. They have Fridays available, for example, but you don't, because you've got 2 classes. So it'll be customized each time.
Okay.
So you can ignore that. Are you all seeing the human needs?
No.
Ah. Okay. I'm trying to figure out how to do a new share. Now, are you seeing human needs?
Yes.
Yes.
Human needs conceptual model of dental hygiene. There are a lot of different models for dental hygiene, and this is one of the more popular ones. This was created at Old Dominion University, and a lot of schools use this. Old ODU has something called the Mosby's book, and Mosby is it's a publisher, but that is another Wilkins type of book that has a very schools will use that instead of our Wilkins, and there's another one out there as well. So depending on what school you go to will depend on whether or not you use what book you use throughout your time in dental hygiene. ODU was developed at ODU, so guess what they use? They use the Mosby's book. The one of the instructors there was the creator of that, and it's a very comprehensive, it's a wonderful book. It's very difficult, it's very technical, and we find that the Wilkins is a little easier for students to understand. So let's take a look at this, because you're going to be doing human needs models 10 times during your time at NOVA, 10 times. Every time you have a test patient or something else is assigned, you are going to be doing a human needs model. It is in Canvas with the paperwork that you have as well. But it goes along as a sort of like the Maslow's, excuse me, hierarchy of needs, if you remember that from psychology. And this is recognized by the World Health Organization. Excuse me, hold on. Phone ringing. So it transcends all ages, cultures, genders, and nationalities. It is recognized by the World Health Organization. It contributes to the quality of life. It emphasizes client-centered or patient-centered humanistic care. It connects the oral cavity with the total person. And you can motivate human behavior as well as guide them to wellness. So This is Maslow's. The physiological is breathing, food, water, sex, sleep, homeostasis, excretion, safety, love and belonging, esteem, and then finally your self-actualization. So when you're doing your medical, dental history and your social history, you are kind of finding out where the patient falls in each of this, and this drives your treatment plan. So Germanna Community College, for example, and Whitfield doesn't do it, but what's the one in Roanoke? They do this for each and every patient before they do the treatment plan. And again, we used to do this on everybody. It just takes too much time. So we just want you thinking about this. But the dental hygiene process, okay, you've got your client, you've got your oral health as well as physical health, you've got your environment and your dental hygiene actions. So the dental hygiene's 8 human needs, protection from health risks, freedom from stress, wholesome facial image, skin and mucous membrane integrity of the head and neck, biologically sound dentition, conceptualizing and problem solving, excuse me, freedom from head and neck pain, and are they having responsibility for their own oral health? So what are some of the dental hygiene actions? Does the patient need to be pre-medicated? Do they need a medical consult? Do you need to modify their care or appointments? Do they need shorter appointments at a specific time during the day? Do they need pain control or anxiety control, nitrous oxide and oxygen, topical anesthetic injections, anti-anxiety medication? What referrals do they need? Do they need any type of counseling, tobacco cessation or nutritional counseling? Are you displaying sensitivity and empathy towards them? Okay, that is something you need to display. Their oral hygiene instructions, what are you going to be doing? Adjunctive therapies, do they need irrigation? Do they need something else like a laser debridement? Scaling, polishing, patient education on the disease process, and patient monitoring. So all of these are examples of the dental hygiene action. Patients will come to us embarrassed. They are in recovery from drug, alcohol, from other things, and their mouth is ferocious. And they're embarrassed. And you just have to say, well, that's then. I'm glad you're here now because today is a new day and we're going to take it from here and move forward to put them at ease. Okay, so let's look real quickly at Devin. Okay, we're going to do this. I do want a little bit of talking here, but Devin is a 12-year-old. Okay, she's new to the practice and has been scheduled for dental hygiene care. So you're the first one to see her. She is a 7th grader and is one of the star players on her soccer team. She's accompanied by her mother, Margaret, and her sister, Bridget. After completing health, dental, and personal histories, the dental hygienist initiates the assessment phase of the dental hygiene process of care. A complete dental and perio assessment is done, and dental hygiene education and skill level assessment as well. The significant findings, okay, now this is for the 12-year-old, include 6 millimeter probing depths around tooth numbers 19 and 30, 4 and 5 millimeter pockets around tooth numbers 22 to 27. Oral hygiene is generally poor. The client has a knowledge deficit regarding bacterial plaque, periodontal disease, and the status of what's going on in her own mouth. So she's just unaware. All right, so she's got some pocketing on the first molars and the mandibular anteriors. And she plays soccer. So what would be some of the questions or concerns that you have for her?
Maybe how often she's brushing and flossing her teeth on a regular basis.
Exactly. Exactly. What is her, she's got a low dental IQ, but these are the dental hygiene human needs. Here, protection from health risks.
So
So
since
that-
she plays soccer, wouldn't you want to ask about like the type of PPE she's wearing, making sure she's protecting herself?
Exactly. Does she have a mouth guard? Freedom from stress. You know, what's going on with the home life, with school? Is she doing okay? She's 12. She's undergoing hormonal things. Wholesome facial image. Is she pleased with how things are looking? 12, you know, most of her permanent dentition is probably in. What does she need an ortho consult? Is she even concerned? Skin and mucous membrane integrity of the head and neck. Biologically sound dentition. Does she have sealants? Does she need sealants? Conceptualization and problem solving. Okay, that's more for when you're discussing freedom from head and neck pain. Is she in any discomfort? And responsibility for oral health. She's 12. Will she heed the education that you're trying to do? So for her. So that these are the things that you look at. And there's a form that you fill out that is in Canvas that goes over, it'll state the protection from health risks. And then it has a column. Does the patient exhibit any of that? Yes or no? And how is it, it's evidenced by? Patient's diabetic, the patient's whatever. And then what are your planned interventions? So it takes you through the thought process. And the whole idea of doing this is once you're done with this, then you can make your treatment plan up. So if the patient's smoking, you're not forgetting that the patient smokes from the medical history. That is going on your human needs. And then your planned intervention would be smoking cessation, if the patient agrees, because they have to agree. You're not just going to badger them. So that is what the human needs is all about. It is one of these things that you're going to be doing on your partner. So I don't care which partner it is, but at the end of all of this, you're going to be writing up your human needs. You're going to be writing up your goals, your self-evaluation, where you have your goals, your outcomes, okay, and what would you have done differently? You're going to be also writing up a paper periodontal chart as well as hard tissue chart on the quadrant that you work on. And you're just going to do as much as what you've gotten through. So if you haven't finished your perio assessment, you're not going to be able to do a whole lot versus if you've gone through hard tissue charting and treatment and that type of thing. But we are here to help walk you through that. And this is something that your mentor will be looking at. And that's who you turn that into.
And so we each need to do one for our partners that we currently have.
I don't care.
Okay.
This week, next week, I mean, you know, it's just one. You just need to do one. It's,
Okay.
it's, and that will be one of your 10 that you have to do. Okay, that is what we had planned to go over today. Are there any other questions?
Miss D, I'm a bit lost. When do we have to turn this in? Like any time in the semester?
When do you have to what?
Like turn these papers in, like fill this.
They are due a
form.
week after you complete your patient. So that is going to be, you've got this week And then everything's due the week after.
So
Okay.
Misty, if I see my patient for the, like, if I'm the clinician for the last time next Monday, it would be the due the following Monday?
Yeah.
Okay, thank you.
Yeah, or, by next Wednesday, even though you're not you might not be, you've got the clinician and then the record keeper because you're sharing things. So we're going to be pretty loose on this. Bring them to me, bring them to your clinic mentor, have rough copies. We'll tell you what we want to see. Because these should be pretty, they're not straightforward, but you should be getting good grades on them. Let's say that. And we want you to be getting good grades on them.
Misty, what did you say the assignment is actually called in Canvas for this, where we'll print the paper from?
It's called Human Needs. Hi, Kathy.
Hi.
You can find it all in like the week 3,